Is there a cumulative effect of blows to the head over time, even if the symptoms of a concussion might not have been present? Is that something that you've seen as doctors?
I'd say yes, absolutely. You know, that is a somewhat controversial topic and something that we're finding more and more about. And I think that the short answer is we're still waiting for a lot of research to come out, but I'll let Dr. Ackerson speak to that a little further.
We're really just now beginning to look at that research-wise. So I have certainly seen athletes that developed post-concussive symptoms without ever having a single significant blow, but where they were having repeated blows over time. I see it in linemen in football, and I see it in heading in soccer. And so we do know that you can develop these symptoms. What we're thinking that may also happen is people that have never been identified with concussions, but may have had these repeated blows over time, may also be placing themselves at risk. But it's harder to say if you've never developed symptoms. Now 10 years, 20 years down the road, it's very difficult to relate that back to those repetitive blows earlier.
So how can research be done to track that then, if it's so difficult like that?
One of the ways that they have done that in soccer is they've looked at people that they identified as being aggressive headers, and they identified, I think they defined it as like average more than 10 headers in a game. But they looked at people that they had quantitatively identified as more likely to head the ball, and other players playing exactly the same sport who do not head the ball as often. And in those individuals, we do see that there are neuropsychological changes. So there are more cognitive problems in people that headed the ball more frequently, even with no diagnosis of concussion. So Dr. Gould's answer, the short answer is right. Yes, we think it could be, but the long answer is we're just now beginning to look at that research, so it's really too early to make any conclusive statements about that.
So Dr. Gould, you work with the concussion clinic at Children's of Alabama. When you see parents and they come in with their kids and you talk to them, do you think that the leagues provide enough concussion education for the parents right now?
You know, that's an interesting question, and I'd say it's really, unfortunately, it's variable. There are some places that are doing a great job, and as we touched on a little bit in the panel earlier, it tends to be the ones that have more resources, that have the really great teams, that have a bunch of trainers and physicians covering their games. They're the ones that have a lot of resources to devote to education pieces. And then the ones that don't have as many resources to devote to the education, we tend to struggle with a little more to bring them up to speed.
And I'm also thinking about like the urban-rural divide in the state of Alabama, yes, because we know that there aren't great concussion centers like you have in Birmingham and other places in the state. Is it particularly risky for these rural schools, and how are medical professionals trying to reach those players?
So the NFL is actually currently sponsoring some continuing medical education that I'm helping to write for emergency medicine physicians. So even in rural communities, we do have emergency departments, and we're trying to educate the emergency physicians, particularly in these rural areas where they don't have access to subspecialists like ourselves, to be able to really manage those frontline concussions, know when they need to be sent on to us, and when they will recover, you know, with just some simple rest within a week or so.
We've also, as part of the task force, we have provided a lot of training for different groups, including physicians. So primary care physicians, family medicine physicians, pediatricians have received training in the proper recognition and management of concussions.
And then one last question from the audience. How do you determine when a player can return to the sport, and how accurate are your cognitive tests?
That's a great question. It is comprehensive. We use a battery of tests. We look at balance, we look at cognition, we look at memory, and sometimes if there's some confusion, I will send them to Dr. Ackerson for really more extensive pen and pencil tests. There's a whole lot of tests out there being marketed for concussion right now, and I don't think that we've identified one simple test right now that really says yes, no. We really have to look at the whole picture, the whole athlete, and this battery of tests to get that information.
I think that's absolutely accurate. Not everybody needs this comprehensive battery of tests, but we do have very well normed tests of cognitive ability, and that can tell us how the person is doing right now. But as I tell families all the time, I cannot rule out the fact that if you go back out there, you might not have another concussion, because if you've had one, now you're 3 to 5 times more likely to have another one. So we can never say you're completely safe. We can say that based on the data that we have right now, it looks like your relative risk factor is low enough that if you choose to return to play, then you can. But an important part of that is, once again, or if there's an athletic trainer working with the team, somebody that's seeing the player every day and putting them through their paces and seeing how they respond as you're increasing the physical exertion, and are they remembering the plays the way that they're supposed to, are they behaving the way that they're supposed to. Nothing can substitute for that. But we do have some well-normed tests that if you see a neuropsychologist and go through comprehensive testing, they'll feel fairly confident that if you clear all of those, that your relative risk factor is going to be relatively low.
Well, thank you very much for joining us for Issues and Ills, and thanks for answering some extra audience questions with us.
Thank you.